Hey everyone, happy Codemas. Let's get right into today's case. It is a blepharoplasty, bilateral upper lid blepharoplasty to correct bilateral upper eyelid dermatochalasis. Pre-op, post-op diagnosis are both the same: bilateral upper eyelid dermatochalasis. Bilateral upper lid blepharoplasty is our procedure, and this is very key when we're doing any type of blepharoplasties or any procedures where there's a right and left side. We have to make sure that the documentation supports this bilateral. So sometimes providers will only document one side and not designate that they were on the right or the left. And that can be problematic because in order to support that this was bilateral and bill it bilaterally, it needs to state that both sides were performed. And sometimes it almost will trick you until you get to the end and they'll say the identical procedure or a mirror procedure was performed on the opposite side. So let's see how this one looks. This 65-year-old female demonstrates conditions described above of excess and redundant eyelid skin with puffiness and has requested surgical correction. The procedure alternatives, risks, and limitations in this individual case have been very carefully discussed with the patient. All questions have been thoroughly answered, and the patient understands the surgery indicated. She requested this corrective repair be undertaken, and a consent was signed. A patient was brought into the operating room and placed in the supine position on the operating table. An intravenous line was started and sedation anesthesia was administered intravenously. After preoperative sedation, the patient was monitored for cardiac rate, blood pressure, and oxygen saturation continuously. The excess and redundant skin of the upper lids producing redundancy and impairment of lateral vision was carefully measured, and incisions were marked for fusiform excision with a marking pen. The surgical calipers were used to measure the supratarsal incisions so that the incision was symmetrical from the ciliary margin bilaterally. So one of the things that I'm noticing here, though, is this to me is kind of borderline. She's saying here that the patient had, basically redundant skin and things, but I'm not seeing that this was significant impairment of the vision. So hopefully when he did the prior authorization of this procedure, if it's something that they're looking for insurance to cover, that they had the appropriate eye exams that designated the patient had significant impairment of their visual field, so that would support insurance billing it. Otherwise, this is probably a cosmetic procedure. The upper eyelid areas were bilaterally injected with 1% lidocaine and 1 to 100,000 epinephrine for anesthesia and vasoconstriction. The plane of injection was superficial and external to the orbital septum of the upper and lower eyelids bilaterally. The face was prepped and draped in the usual sterile manner. After waiting a period of approximately 10 minutes for adequate vasoconstriction, the previously outlined excess skin on the right upper eyelid, so we're on the right upper eyelid, and that was excised with blunt dissection. And remember, blunt dissection means that they're basically using an instrument, like maybe like this pen or a blunt surgical tool to dissect, not using as opposed to a sharp instrumentation like a scalpel. Sometimes blunt dissection also just means they use their fingers, but in the case of an eyelid, I'm thinking it was probably not use of the fingers. Hemostasis was obtained with a bipolar cautery, a thin strip of orbicularis oculi muscle was excised in order to expose the orbital septum on the right. The defect in the orbital septum was identified, and a herniated orbital fat was exposed. So that might come into play. Herniated orbital fat that was exposed. The abnormally protruding positions in the medial pocket were carefully excised and the stalk meticulously cauterized with the bipolar cautery unit. A similar procedure was performed exposing herniated portion of the nasal pocket. Great care was taken to obtain perfect hemostasis with this maneuver, because obviously they don't want to accidentally puncture the patient's eyelid or this nasal pocket. A similar procedure of removing skin and taking care of the herniated fat was performed on the left upper eyelid. So there we go. We've got support that we did the right upper and left upper in the exact same fashion. And again, this was also herniated fat. Careful hemostasis had been obtained on the upper lid areas. The lateral aspects of the upper eyelid incisions So that means multiple because we have incisions, not one, just incision. They were closed with a couple of interrupted 7-0 blue proline sutures. And then here's our just end of outcome. At the end of the operation, patient's vision and extraocular muscle movements were checked, found to be intact. There was no diplopia, no ptosis, no ectropion. Wounds were re-examined for hemostasis, and no hematomas were noted. Cooled saline compresses were placed over the upper and lower eyelids bilaterally. Procedures were completed without complication and tolerated well. Patient left the operating room in satisfactory condition. A follow-up appointment was scheduled. Routine post-op medications prescribed and post-operative instructions given to the responsible party. Patient was released to home in satisfactory condition. Now, I've talked in the past about how oftentimes you can go right to the system and sometimes find the code as opposed to looking in the alphabetic index. And in this case, this might not be a good way to do it if you're not familiar with these types of procedures, because actually if you go to the skin procedure, which is where this is, the eyelid procedures are in this section here of other procedures, so they're a little bit more difficult to find. So let's start out just by going into our index in the back and checking in there. So if we look at these codes here for blepharoplasty, they're all within about the same range, except for this canthoplasty, which is not what we did. So we have 15820 through 15823, and this is also the same eyelid reconstruction, 15820, 15823. So here we have blepharoplasty, lower eyelid, upper eyelid, and then we have with extensive herniated fat pad with excessive skin weighting down the lid. Now let's take a look at what we had here. So we had, this was an upper, and it does say here that there was some fat. There was herniated fat, but this doesn't actually say that this was any kind of extensive herniated fat. And this here says extensive herniated fat. So it clearly says extensive. So this just doesn't, to me, say it was extensive. If they wanted it to be, to just be any herniated fat, they wouldn't have included that word here that says extensive herniated fat. They're expecting probably some herniated fat, but if it is an excessive and extensive amount of herniated fat, that's when we can use this 15821. So I don't think that that's probably what we're looking for. And also, this is for lower eyelid. We did upper eyelid, and this upper eyelid is with excessive skin weighting down lid, and that wasn't indicated in here either. So I'm not seeing anything previously outlined excessive skin in the right upper eyelid, but it doesn't say anything that this was like weighing down the patient's eyelid. Patient was brought into the operating room, placed in the supine position. Redundant above excess and redundant eyelid skin, which is exactly why you would have a blepharoplasty, because you have excess skin, but it doesn't say excessive skin weighing down the lid. Now, one thing you can do sometimes if you're not 100% sure if it meets the criteria or not, there are books you can purchase that have the lay descriptions in them, or if you have one of these tools like Codify, they do have the lay terms that you can look up for the procedures. And this one says, in this procedure, the provider surgically trims excessive skin that weighs down the upper eyelid, typically to improve cosmetic appearance of the face due to interference of the tissues in the patient's vision. And again, I'm just not seeing that this was supporting the excessive amount of skin that's weighing it down. So I'm thinking 15822, and then we would need a 50 modifier. 50 modifier is bilateral procedure. So if you need your list of modifiers, it is at the beginning of your CPT book. So your 50 there is your bilateral procedure. There are some differences with insurances. Some of them want the RT-LT, which is over here, LT left side, RT right side, broken down on two different lines. But we're going to talk just in general terms. 50 modifier is bilateral. If you're sitting for a coding certification, that's likely what they're going to test you on, is using that 50 modifier for any bilateral procedure. Now, we're not done here. We need our diagnosis code as well, correct? Okay, so here's dermatochalasis eyelid. That would be our unspecified code. And then we have left and right, and then we have the lower and upper for each of them. So we actually will need 2 different diagnosis codes here. We're going to need the left upper and the right upper. So we have H02834, H02831. Let's check those in the tabular list to make sure that we don't need any 7th character extensions. And it doesn't look like we need a 7th character. We just need a 6th character, which we have for the right upper and left upper eyelid. So that's it. That's what we need for this coding case. 15822 with a modifier 50 for bilateral, and then H02834 and H02831 for both of our upper eyelid dermatochalasis. I hope you found this video helpful. If you did, make sure you give it a big thumbs up. Don't forget to subscribe and hit that notification bell so you get alerts when I post new episodes. I will see you in the next episode. And until then, just keep on coding on.